Thanks, Rick. And Kevin Kruger, our MLA for Kamloops North Thompson, was unable to be here today, but his executive assistant, Pam Tyler, is here. Would you like to?
Right in the middle.
Thank you for your commitment. Help us struggle for life.
Can I phone you back? Okay, great.
Volunteers for the Transplant Society. Each and every week she is up at Royal Inland Hospital really promoting the issue. Ask Linda Bonner Brown to say a few words.
George, what a wonderful job you are doing. I'd like to present you with an organ donor green ribbon. I don't know if you have one.
We have lots.
You have lots.
Got to put mine on.
I would like you to have one too.
Thank you.
My husband passed away last year. He couldn't have a transplant, but I'm really happy that you're making people organs. Thank you very much.
One of the our members of our city staff is here, who is the recipient of an organ transplant, and he's the brother, I understand, of one of our council members, John DeChico, and I would like to ask Nick DeChico to perhaps say a few words.
I had a transplant 4 years ago.
Oh, wow.
My sister donated a kidney.
Oh, good for you.
Yeah.
Good for you.
Hi, I'm Mary. It feels just as good to give as it does to receive it.
Yes, yes.
Yeah.
That's great.
It's very commendable what you're doing. I mean, it's unbelievable, and people should be aware because we're living proof that it works, and people should give.
Nick's getting married tomorrow. So.
Oh, wow.
Yeah.
Congratulations.
Thanks. Appreciate it. Great. Thank you.
Thank you for what you're doing.
We'll talk after.
Yes.
And before I ask George to say a few words, is there anyone else who would like to speak this afternoon who is not on the list? All right, I have a couple of things to. I just, George, because of all you do and because of the importance of it, I have here a letter of thank you on behalf of Kamloops City Council, and as well, of course, a City of Kamloops pin and a personal check from myself in the amount of $250 to help in your steps.
Oh, thank you so much.
And as well, I would like to present to Linda. Where did Linda get to? Oh yes, Linda. This is one of those precious donor registration cards that are so important and that you promote the awareness of, and I have filled it out for you. I don't know what kind of shape my organs will be by the time it's time, but whatever can be used, I'm happy to let somebody else use them
Thank
after
you very
I
much.
no longer can.
And I hope you can get more people to sign up.
And Ford, I think we'd like to hear about that.
Thank you. Well, like I mentioned earlier, today is day 347. Along the way, I visited about 235 cities and towns, and we arranged police escorts and press conferences and activities in the community while we were there. To bring a very important message to that community, and that was the importance of organ and tissue donations. And also, we were doing our best to encourage all three levels of government to make this issue more of a priority on their respective agendas. And I think we've done pretty good in both areas. But there's a lot of more work left to be done. We were very happy to see that the Federal Minister of Health, Alan Rock, take that step about a month and a half ago to bring a little more attention to this area and develop the National Council on Organ and Tissue Donations and put $20 million towards it. And we feel that's a very good first step. But there's a lot more work to be done with that first step. We still need to look at changing our system. It makes it real easy for me to come to BC and talk about this, because BC already has the best system in the country, and that's a registry along with making the decision legal binding. And this is what we've been promoting right from the beginning, from every province that we've been to. And we've been to Ontario, Manitoba, Saskatchewan, and Alberta. And as we've been mentioning this to people, how they feel about it, many Canadians from all walks of life, how they feel about this system of having your decision legal binding and having a registry so to be stored in a data bank. Overwhelmingly, I've had the support of every Canadian that I've talked to. So this is no longer something that we feel that because of this response that the health officials and policymakers should seriously start looking at what Canadians want, you know, and they are saying it loud and clear that they want a registry with a legal binding decision. We also are supporting the Alliance's plan, and I'm not taking any sides with political parties, I just want to make that clear. They have a perfect plan also. We've actually been in contact with Dr. Keith Martin several times, and they have a good 8-point plan that also includes something that's called mutual consent, where there will be an option available for a recipient to meet their donor family. At present, we don't have one in Canada. At present, we're communicating through a screen letter, which is, you know, good to say your thanks and everything, but for people like me that aren't too good at letter writing, I really want to go an extra step further than that, you know, and possibly meet the donor family if they would wish to meet me. So if it became a mutual desire, along with some guidelines, there should be an option for recipients to meet the donor families, and that would certainly bring a lot more incentive to the public when it comes to knowing that one day they can meet the recipient of their loved one, and with their loved one's organs still carrying on, there's a sense of continuance there. You know, there's so many benefits to that. So we feel that our system needs a lot of updating, and you know, we're giving a nice little nudge to the federal health minister and any of those people that are doing the policy making. And we're hoping that one day we can have a country that we will no longer have a dismal rate of organ and tissue donations, but we will have a plentiful rate, and people won't be desperately waiting for organs, but optimistically anticipating that. So along with that, I really want to thank the community of Kamloops for giving me a very warm welcome, for having Officer Kate. I can't just say your last name because I must pronounce those names.
Constable Kate anyway.
Constable Kate for coming out and carrying the torch, and all the dignified guests for saying some very wonderful words. And my road manager is going to wrap it up with some of the final thank yous. He'll say it more appropriately. And my road manager is David Wrightsmith, who joined me in Alberta when I went through my 6th road crew. Yeah, it's not that, you know, they all come on with good intention and wonderful enthusiasm, but they come on after the honeymoon period's over, after 2 months, they can't take it anymore, so, you know, but it's David's promised to see me to Victoria, and he's doing an excellent job in doing that. So if you wanted to come up here, David, and say a few words.
George said it all. I mean, you know, what more can I say other than to repeat the thank yous that he's already stated. And I also have had a liver transplant, and ironically, or coincidentally, it was the day before George had his, and we didn't know each other. It just so happened that we were at opposite ends of the country going through the same thing at the same time. So when I heard about his walk, I've been involved with another related support nonprofit environment, and I decided that when he arrived in British Columbia that I was going to try and help him out. So he phoned